The statement that not all rheumatic diseases are autoimmune and not all autoimmune diseases are rheumatic is accurate and reflects the complexity of both categories of diseases. While there is overlap between autoimmune and rheumatic diseases, they are distinct in nature, with some conditions not fitting neatly into either category. Here's a breakdown. HARA 1. Rheumatic diseases. Rheumatic diseases are conditions that primarily affect the joints, muscles, bones, and connective tissues. Although many rheumatic diseases are autoimmune in nature, not all of them are. Autoimmune rheumatic diseases. Many of the well-known rheumatic diseases, like rheumatoid arthritis, RA, systemic lupus erythematosus, SLE, systemic sclerosis, and ankylosing spondylitis, are autoimmune. In these conditions, the immune system mistakenly attacks healthy tissues, leading to inflammation and damage, particularly in the joints and connective tissues. Non-autoimmune rheumatic diseases. Some rheumatic diseases do not involve an autoimmune process. For example, osteoarthritis. This is the most common form of arthritis and is not autoimmune. It is primarily a degenerative joint disease caused by the wear and tear of cartilage. Gout. Gout is a metabolic disorder caused by the buildup of uric acid crystals in the joints, leading to inflammation and pain. Although it can mimic autoimmune arthritis in presentation, its underlying mechanism is metabolic rather than immune-mediated. Fibromyalgia. Fibromyalgia is a chronic pain condition affecting muscles and soft tissues. It is not autoimmune, and its exact cause remains unclear, though it is often associated with abnormal pain processing in the central nervous system rather than immune dysfunction. FAP2. Autoimmune diseases. Autoimmune diseases arise from the immune system mistakenly attacking the body's own cells. While many autoimmune diseases fall under the category of rheumatology, there are numerous autoimmune conditions that do not primarily affect the musculoskeletal system. Autoimmune rheumatic diseases. As mentioned earlier, diseases like RA, lupus, and spondyloarthritis are examples of autoimmune diseases within the rheumatic category. Non-rheumatic autoimmune diseases. Many autoimmune diseases primarily affect organs or systems outside of the joints and connective tissues and are not considered rheumatic diseases. For example, type 1 diabetes, an autoimmune disease in which the immune system attacks the insulin-producing beta cells of the pancreas. Hashimoto's thyroiditis and Graves' disease, autoimmune diseases affecting the thyroid gland, leading to hypothyroidism, Hashimoto's, or hyperthyroidism, Graves'. Celiac disease, an autoimmune disorder where the immune system reacts to gluten, causing inflammation and damage to the small intestine. Multiple sclerosis, MS, an autoimmune condition where the immune system attacks the protective covering of nerves, myelin, in the central nervous system. Key differences between rheumatic and autoimmune diseases. 1. Organ systems involved. Rheumatic diseases primarily affect the musculoskeletal system, joints, muscles, connective tissues, although some can involve internal organs. Autoimmune diseases can affect a wide range of organs and systems, including the endocrine glands, skin, kidneys, lungs, and nervous system. 2. Underlying mechanisms. Rheumatic diseases may be autoimmune, degenerative, metabolic, or idiopathic in nature. Autoimmune diseases always involve a malfunction of the immune system where it attacks the body's own cells, but they can affect various organ systems, not just the joints or connective tissues. Conclusion. While there is significant overlap, particularly with autoimmune diseases that affect the joints and connective tissues, rheumatic diseases, the two categories are not synonymous. Not all rheumatic diseases are caused by autoimmune processes, and not all autoimmune diseases manifest in the musculoskeletal system. Understanding these distinctions helps guide diagnosis and treatment approaches for patients with various conditions.